Forces Association, and most especially DAV. We are so proud and privileged to partner with DAV, and it is DAV's support, generosity, and commitment to this series that makes today possible. We are so grateful that we've had a longstanding partnership with DAV, and we encourage as many of you as possible, if you're not already familiar with DAV, to familiarize yourself with DAV's amazing programs. It's more than 1 million strong members, and a real inspiring example of the kind of services and supports that our nation's veterans need and have earned through their service. Today's event is the 10th convening of the DAV Speaker Series, and the goal of the series is to bring together important leaders and advocates to shine a spotlight on the unmet needs of veterans and disabled veterans and their families and society on a large scale, to create a platform for both conversation but ultimately action. And we very much hope that today's theme and our distinguished lineup will fulfill this goal. We have a terrific lineup of distinguished leaders from California and Massachusetts to talk about their work and innovations happening at the state level, focused on veterans services and supports. Our moderator will be Coleman, whom I'll introduce in a moment, and Coleman will then introduce our panelists. But for the moment, let me just do a little bit of administrative note for everyone, which is that we are going to have a Q&A period at the very end, and you can submit your questions through the Q&A function, not through the chat function, but through the Q&A function in the webinar, and the link is at the bottom of your screen, and if you click Q&A, you'll be able to submit your questions, which we'll try to take up as many as we can at the end of the program. So let me just introduce quickly our good friend and incredible champion of veterans everywhere, Coleman, a distinguished graduate of American University. From 1987 to 1993, Mr. Nee served as a member of the United States Marine Corps Reserve, rising to the rank of corporal, where he also served during Operation Desert Storm. In 2008, he was named Undersecretary of Veteran Services here in Massachusetts, where he oversaw the creation of a really important program called Statewide Advocacy for Veterans Empowerment, which supports veterans and their families coping with the stresses of reintegration from military service, focusing on critical issues like suicide prevention, financial stability, and health. In 2011, he was named Secretary of our State Department of Veteran Services, what is now known as the Executive Office of Veteran Services, by then Governor Deval Patrick. And as then Secretary he was an incredible and powerful leader to bring change and programming and supports to veterans across the Commonwealth, innovating, creating new opportunities and new services, and really created a wonderful legacy that our current Secretary, Secretary Santiago, has now inherited to carry the torch forward. And importantly, Mr. Nee is also the Vice Chair of the DAV Board of Directors. So we could not be more pleased to have this esteemed group together. And I would like to turn over the proceedings to Coleman, please.
Thank you very much, Dan. Professor Nagin, thank you also for your efforts in convening these important conversations, as well as for the Veterans Legal Clinic at Harvard. I would be remiss if I didn't thank not only you and your staff for organizing this and keeping this initiative going, but most importantly to the students at Harvard Law School that are participating in the Veterans Legal Clinic. Your admission into Harvard Law says a lot about your academic achievements and your desire to work hard and your intellectual capacity. But I can tell you the work that you're doing with the Veterans Legal Clinic, speaks a lot to your integrity, your character, and your patriotism to support those who've served in uniform and their families. So to all of the students who are involved in the clinic, please, on behalf of DAV and myself as a veteran, thank you very much. It is a tremendous honor to be here today. We have two amazing panelists. I'm going to give you a brief snapshot of who they are and their distinguished careers. I'll start with the West Coast, we will go to Secretary Lindsey. Secretary Sin was appointed Secretary of Calvet by Governor Gavin Newsom in May of 2023, after having served several roles at Calvet since 2011, including Deputy Secretary of Communications and Deputy Secretary of Women's Veterans Affairs. She's the first woman to serve as Secretary of Calvet since the appointment of Virginia May Days as Director in '75. Secretary Sin, after graduating from high school in her hometown of Sacramento, enlisted in the United States Navy and served from 1997 to 2005 as a cryptologic technician interpretive in the Arabic language. She completed 2 flight tours in Rota, Spain, during which time she deployed in support of Operation Northern Watch, Southern Watch, Enduring Freedom, and Iraqi Freedom, and achieved the rank of Petty Officer First Class with Naval Aviation and Naval Aircrew designations. After separating from the Navy, the Secretary returned to Sacramento, worked as a lead certifying official for Veteran Services at American River College. She continued to work with veterans at Sacramento State as the Veterans Benefits Advisor, focusing on developing programs for student vets. The Secretary has a BA in History, magna cum laude from Sacramento State, and an MBA from Drexel University, and she resides there still with her family in California and Sacramento. Additionally, we also have, as was noted, Secretary John Santiago, who was sworn in by Governor Healy and Lieutenant Governor Kim Driscoll as the first Secretary of the Executive Office of Veteran Services on March of 2023. Secretary Santiago is a lifelong public servant who brings an unwavering commitment to ensuring that mass veterans have access to services and benefits worthy of their service to our nation. Prior to this, he was the state representative for the 9th Suffolk District in Boston, where he advocated to increase funding and services to address the substance abuse epidemic, affordable housing issues, and tackle health disparities amongst varying populations. He is also a board-certified emergency medical physician who Medical Center, which is the city's safety net hospital and New England's busiest trauma center. When COVID-19 pandemic hit, he doubled his hours in the emergency room and served as a member of the House of Representatives COVID-19 Working Group and Vice Chair of the COVID-19 Committee to advise policymaking and ensure state government accountability. Prior to completing medical school at Yale University, he spent 5 years abroad including service as a Peace Corps volunteer in the Dominican Republic and a Fulbright scholar in Paris. He is currently a major in the United States Army Reserve, and he has deployed overseas twice. So welcome to both of our guests. It is an honor to have both of you here, and you have such distinguished backgrounds. A little bit about how the Distinguished Speaker Series really comes about is due in part to significant and generous contributions from DAV, Disabled American Veterans, which has a strong and vibrant partnership with Harvard Law and the Veterans Legal Clinic. DAV, for those who may be unfamiliar, is a nonprofit that provides a lifetime of support for veterans of all generations and their families and survivors. Every year, our no-cost services help nearly 1 million veterans access the benefits and healthcare they've earned, while connecting them with meaningful employment and representing their voice forcefully on Capitol Hill and at various state houses and state legislatures. As one of the leading vet service organizations, DAV has been focused on keeping the promise to America's veterans for more than 100 years. And I can tell you that many of the topics that we're going to discuss here today are issues that are of great importance to DAV nationally. And you can, if you want, read some of our latest reports, which are really comprehensive and very interesting and very relevant. We've done 3 reports on women veterans, including our latest report, The Journey Home, which looks at women veterans and mental health care access. We have recently released a report on the wait for toxic exposure presumptions amongst veterans who've been exposed to toxins while they were deployed. And that was in conjunction with a partnership with the Military Officers Association of America. And then, a few years ago, we released a very comprehensive report on the challenges and inequities facing veterans caregivers. These are all available at dav.org if anyone wishes to read them or any other information. But in short, I think we're all aligned with the fact that there are significant challenges for a very diverse veteran that exists in our country today. And in addition to what we're doing at the federal level, I think what we'll hopefully hear today is some of the unique and innovative programming and outreach efforts taking place at our state level as well. There's a few challenges that we're highlighting. Number one, this is a new generation of veterans, an all-volunteer fighting force, and we've also through that engaged in arguably America's longest wars over the past 2 decades. And because of the nature of these conflicts and the diversity of these conflicts, a new generation of veterans have come back with distinctive experiences and needs. Long-term physical and psychological vulnerabilities for this new generation of veterans are really just beginning to be understood, and much research still needs to be done in order to help us to be able to care for these veterans quickly and at the right time to help them not only reintegrate back into our civilian society, but get the care and support and resources they need to be able to grow and thrive. We have aging veterans. I know one of our big issues that we look at constantly is our demographics and our population, and it is particularly in areas like Massachusetts, where we have a majority of our veterans who are 65 years and older, presenting complex health, financial, and social needs, looking at the future and in terms of aging in place versus assisted or long-term care living. Understanding the health impacts of earlier wars, and also realizing that there is a concerning trend that increasing number of older veterans are experiencing housing insecurity for the first time, in many ways because housing has become so expensive. And I think Massachusetts and California being on here is very apt, given the housing issues that are facing the general population in both of our states. There's also been dramatic shifts over the last few years in veterans and the various populations within them, which I think give our panelists here a unique opportunity to address. But also, I would say they are probably engaged in probably the most difficult challenge that any veteran service government official has ever faced. Since the start of our VA and our current system and network, specifically the fact that when we see veteran population, we see that women veterans are the fastest growing segment of the population. We see large increases in our African American and Latino veterans. We know that many veterans in the LGBTQ plus community have experienced varying issues and challenges, especially with regarding Don't Ask, Don't Tell, and how many of them are working with less than or other than honorable discharges, which for no reason other than just they for being who they are. And how are we addressing that issue, and also how are we getting those veterans into the resources and benefits that they have earned just as much as anyone else, to help them in terms of their lifestyle and in terms of how they are hoping to grow and thrive, and get issues addressed that are related to their military services. And we still see a lot of shifting employment barriers and opportunity, as well as opportunities, but hurdles to financial stability, especially when we look at the relationship between service-connected disabilities and work opportunities, transitioning smoothly from military service into the civilian realm, utilizing and improving on our GI Bill benefits to ensure success for the veteran as well as success for their family, and as we've talked about before, housing and other issues that those veterans may be facing. So with that as a backdrop, we're really going to focus on these and some other challenges today. But we're really going to look at this not from a standpoint of a national standpoint, but from the innovations taking place at the state level, where we have a partnership with the VA, which is obviously a very critical and important part of our veteran service system. But I think in a lot of ways, sometimes the state level gets left out because of the size of VA. And a lot of people don't realize that at the state level, many veterans are receiving the services and benefits that they've earned because of unique initiatives and unique partnerships. And we are doing better at the state level more and more as the years go on to make sure that we're caring for those veterans, that those veterans are connected to all of their federal and state resources and benefits, and making sure that that those innovations are being measured and as well as hopefully being shared amongst other state veteran secretaries, so we can have best practices as kind of a common thread throughout the country. And so just to put a point on this and get to our panelists and get some questions, I guess I would quote a very famous Harvard Law School alum, early 20th century Supreme Court Justice Louis Brandeis, who said that the individual states are our laboratories of democracy, the place where experimentation and innovation most naturally takes place. And moreover, because our veteran population is, of course, different in each state, requiring different approaches and different public policy choices is vital. So with that, I am, and with the help of our distinguished speakers, we're going to turn the spotlight onto those innovations taking place at the state level and ensure that our veteran community is receiving the best care and possible support, regardless of where they access any of these systems. So I'd like to take a moment to go to Secretary Sin and ask her, just a basic question, and Secretary Santiago, I'll ask you to answer the same question. Give us a sense of the veteran community that exists in your state. How big is it? What are the primary demographics and key characteristics that you're focused on? And I'll start with Madam Secretary, with you first.
Well, thank you so much, Vice Chairperson Nee, for having me here today. I really appreciate it. Dr. Santiago, it's always nice to see you, and I appreciate getting the chance to speak with students at Harvard Law. Really think this is a great collaboration between DAV and Harvard, and just appreciate any education or information that we can provide from our perspective here in California. So thank you. Well, first of all, I would say up until very recently, California held the top spot for the most veterans of any state in the nation. So when I started this work in probably 2008, 2009, we were nearly at 2 million veterans, just counting veterans, not counting active duty, not counting reserve and guard, or family members of veterans and military communities. But we've always held the top spot as far as number of military bases, number of people enlisting in the military, and then for up until very recently, the number of veterans. So our veteran population in California continues to be in decline, as it is across the nation. We are now second to Texas, unfortunately. And we will continue to see this decline over time, although we are doing our very best to keep as many veterans here in our state, in the great state of California. Among the demographics of our current population, and I would say our number is somewhere between 1.4 and 1.5 million veterans. We do typically rely on VA population data models to kind of give us a picture of veterans by state. And that model sometimes changes because things change. There's different factors that they look at in kind of laying out what the population is going to look like in the future. So that's why I give an estimated number. But among that population, we do see an increasingly female and an increasingly diverse set of veterans, which makes sense because the majority of our older veterans were drafted into World War II, Korea, or Vietnam, and tended to be male and white. And of course, since the military went to an all active duty force, that gave the military branches the opportunity to recruit individuals who were looking for opportunities to serve their country. And maybe that was because they needed economic and job training opportunities, because they wanted to go to college on the new GI Bill at the time. But it really opened up, of course, with additional policies as well, allowing women and minorities to serve in greater numbers. It opened up opportunity for a lot of people, and I think you all know that. But it means that about 10% of our population here in California, 10% of our veterans are women veterans. We have an increasing and probably the largest ethnic demographic population of non-white veterans as well, including Native American veterans, Asian and Asian Pacific Islander veterans, and Black veterans and Latino veterans. We also have a high percentage of LGBTQ plus veterans. Although I don't have the specific numbers or percentages, we know that we do occupy some of the top spots in the nation for that as well. So what that means is our programs and services and really our mindset need to adjust and change to make sure we're meeting the needs of all veterans in California. And so that's something that our governor is very focused on, making sure we create a California for all. It's something that we are very focused on in our own department. And a lot of our newest programs and the way we even talk about our veteran population have really been built to reflect this changing demographic. So right now, about 53% of our current veterans are over the age, or I'm sorry, are under the age of 65. So we still actually have the majority of our veterans not quite into retirement age, still in working age. We are going to see that continue to increase up to almost 65%. By 2050, 65% of our veteran population will be under the age of 65. So that means that the Gulf War era and post 9/11 era veterans will be occupying the majority of veterans in the state, as our World War II, of course, Korean War veterans and Vietnam era veterans pass away. That said, we'll still have a pretty significant population of Vietnam era veterans. And some interesting things about our demographics mean that the needs of our veteran population is really stratified across different kind of life stages. So our Vietnam era veterans are unfortunately presenting with more mental health and physical health needs and ailments as compared to our World War II veterans in particular, which means that our services need to adjust to meet their needs in long-term care, whether that's aging in place at their homes or where we would care for them in our 8 long-term care facilities across the state. So those are all things that are kind of top of mind for us when it comes to the demographics here in California.
Excellent. Thank you very much. That's really interesting, the data, particularly around the younger veterans too. That creates, I'm sure, a lot of challenges. Secretary Santiago, I know you might have a different demographic population. You might have different things that you're looking at. Specifically, how are you recognizing those, and then also outreaching to make sure that they're getting what they need?
Great. Well, thanks everyone for having me on this. Mr. Vice Chair, it's good to see you again. I think, as you said, you were the former secretary here, and I think a lot of the work that you started, all the innovations you put forward, we're effectively building on them. So I just want to thank you for that. And the folks at the Veterans Legal Clinic at Harvard, Dan Nagin, you guys are a source of guidance. I met with you early on in my tenure here. I've been here for about 1.5 years now. And I think the message that you put forth, the inclusivity, just the goodwill that your organization alongside us have really brought forward to the veteran community, I think it's very much welcome. And so we look forward to continuing that relationship and working closely together to serve veterans in the Commonwealth. And Secretary Singh, good to be with you. Good to see you again. I look up to California. I mean, I think, first of all, your website is fantastic. And so it's nicely organized, and me and my kind of detail-oriented kind of ways look up to different secretaries and how they operate and how they innovate. And I think California is really a cut above there. And the records you have working in that office and the variety of roles you play, it's really something to behold as someone who wasn't really active in this space. I mean, I'm a veteran, I've deployed a couple of times, but it's nothing I never really thought about getting involved with until I was selected to be the first secretary here about 1.5 years ago. Well, I will say, with respect to the question, a lot of the trends that Secretary Singh put forth are in alignment with what Massachusetts has. I mean, at a grossly different scale, of course. I mean, Massachusetts is nowhere near the size of California, But on the whole, I'd say I'd put a number at about 240, 260,000 veterans. But that also has been declining significantly, as Secretary Sin said, for a variety of reasons. I mean, people are passing away. So there's also some reasons to suggest people might be moving out of the state for a variety of reasons here. The last time that we've had an assessment to look in that, I think with some accuracy, was about 2017. Was an organization by the name of RAND that did a pretty comprehensive study to look into not just the number of veterans, but their demographics, the services they need, and to do a needs assessment. And that hasn't been done in, 7, 8 years, never mind a global pandemic that took place just a couple of years ago, and how that's changed the name of the game here in Massachusetts. So with that said, we've actually partnered with RAND to look into that study. How do we redo it? How do we figure out where we're at? As a physician, we're always trying to, look at the data and let that guide us. And that's the same approach we're taking here at the Executive Office of Veteran Services. So with that said, there's about 240,000 veterans, we think, a declining population, not very diverse, right? 90% are white and about 8%, 7.4% are women. And so what does that mean? That means that we, as the Secretary said, need to be having programming operations that really reflect that population, but not the current population necessarily, but also its trends. We know that more women are becoming veterans. We know that more people of color are becoming our veterans. We know that we should be more inclusive and progressive in terms of the programs and offerings that we are giving veterans across the Commonwealth. And that's not just a mission that we have here at the Executive Office of Veteran Services, but from the governor on high, who believes in this message and this commitment to supporting our veterans. I think two things that the Secretary said that I want to highlight on. It's just the age difference that we're seeing. Here, over half are still over 65 years of age in Massachusetts. And so what does that mean? How are their physical needs being taken care of? Their long-term care needs, which it's incredibly expensive, right? I mean, these veteran homes, they are a miracle for some families that can't really afford the private sector, right? But their physical needs, how they're connected to the VA, for those types of things. But below that, at about 22%, almost a quarter, you have the GWAT veterans, and that number is significantly increasing at a pretty rapid clip here. And their needs tend to be different here, right? How do we connect them to service to transition them effectively? How do we get them the mental health services that they need? How do we make sure that we're caring for their families as well? One of the things that we try to do here in our office is to make sure that we're not just working with the veteran, but their family as well, right? I think what we all know as veterans, when we deploy, we left family back at home. They're having their issues and their challenges as well. And so how do we look at this and approach this from a family unit perspective? And that's one of our goals as well. So I think that's the top line here in Massachusetts. Things are changing and we need to evolve with that change.
Excellent. And certainly all of that is completely relevant, very on point. And especially as we look at, and I'll kind of set this up as a basis for my next question. When you look at previous generations of veterans, when you look at the age population and the bulk of them, they tended to come back relatively, the majority of them being the same age. So, if you look at World War II, I think the average age of a deployed service member was 26 years old, and it's about 22 to 23 years old in Vietnam, which means when these veterans came back, by and large, they were making generational leaps together so that you could serve those. The unique challenge, I think, from the last 20 years for OIF and OEF is because of the or extensive use of our Guard and Reserves as well as multiple deployments. The average age of our veterans that serve there is like 34 and a half to 35 years old. So as you look at that and you see, wow, I mean, I don't have one group of people that are generationally in college education, buying homes, building families. You have veterans now that half of whom might now be applying for long-term care and aging services, and half of whom from the same conflict are getting access to home loans and GI Bill benefits and building their families. So given that they all served in the same place, are there any unique specific programs that you're using to kind of reach certain targets of that veteran population, and how are those coming together? I'll give that to Secretary Sin first.
Sure. I think you're bringing up an excellent point, and this is something that I was just talking to people about yesterday. I'm down in San Diego right now. We do an annual statewide leadership summit once a year here in San Diego. And the reason we come down here is because the bulk of our veteran population, as well as a lot of our kind of veteran leaders, are down in the Southern California area. That said, it gives us an opportunity to kind of share best practices and to really understand what's happening throughout the state. And that's the point that was brought up yesterday, which is that even calling someone a younger veteran isn't really the correct terminology, because someone transitioning from the military could be doing so after 20, 25 years of service. They could be doing so after a long stint in one of our Guard and Reserve units where they qualified for active duty service at some point. It could be somebody like me who served less than 10 years, or somebody who did one stint, for 2 to 4 years, which means that the ages and stages of someone's life after they come out of the military are all over the map. So here in California, we've emphasized over the last probably 9 years a program called California Transition Assistance Program, CalTAP, which really was the state's answer to working directly with transitioning service members or soon to be transitioning service members into veteran status all throughout the state. So we're all familiar probably with the TAP program, which is run kind of in collaboration between VA and Department of Labor and DOD. And that program happens on military bases all across the nation and even overseas, really allowing service members to get some basic information about that transition. And that program has gone through a number of iterations, lots of investment, I would say, to change it, because it needs to be more effective, bottom line, than it has been. So California's response to that around 9 years ago was to create the CalTAP program. And we are happy to say that, we're on every single military base. We're on every community college campus here in California, offering service members more information about their transition program, about their transition. And the program can be accessed online. It can be accessed in person. Obviously, during the pandemic, we shifted heavily to webinar format. And we really have CalTAP staff going out regularly every single day of the week, pretty much, to provide this type of direct connection with these transitioning service members or new veterans. And the intention is that we're reaching people at all stages of their lives, giving them an opportunity to learn about education benefits here in California, how to get a home loan with us, how to just make that transition mentally out of the military and what that might mean, behavioral health issues they might want to look out for, how to get connected with their community-based system of care, regardless of the region they live in California. So I think that's one probably overarching way we've really leaned into the issue of understanding that our service members are going to need to transition into the veteran status at some point in their lives, and that is really going to vary across their kind of life stages, and that we want to be a resource for them regardless of where they are. It's not just a one-touch, okay, here's some information from CalVet, sign up for your benefits and done. We hope to see them again when they want a home loan from us. We hope to see them again when they have questions about long-term care, even when they want to be interred in one of our state cemeteries. It's an opportunity for us to really build a relationship over their lifetimes with our department. But it's not just our department. It's also a community-based system of care that exists among our county veteran service officers, with our nonprofit partners that help us, with local VA medical centers and community-based outreach clinics in their areas. It's really a whole suite of partners, as represented by what we're doing down here in San Diego right now, that are supporting service members as they come out and turning into veterans. But that all starts with the recognition that this is a really diverse population that has, served at many different eras, ages, and stages, and we can't just make a one-size-fits-all for them. Oh, you're muted.
I'll get this right after 4 years.
Yeah, right.
Secretary Santiago, would you like to weigh in on that?
Sure. I think taking the 10,000-foot view, I agree with what Secretary was saying, but I just want to focus on what you said, Coleman. You talked about data, right? Understanding the population that we're working with, right? You gave some very specific numbers for what the World War II, Vietnam era looked like vis-a-vis what we're seeing today, right? And because you did the research, you understand the backgrounds of folks, how that implicates the operations of the programming. That's the key there. As I often say, you don't know what you don't know, right? And so as we started this new office here at the state level for Secretariat, we needed to understand what the makeup of the veteran community is here, right? So we talked about that RAND study, but numbers are just numbers, right? And so we thought it was central to our goal really to engage veterans, right? If I've ever read a study from the VA or the state or services at the state level, municipal level, talking about veteran benefits, program services, the gap is always the engagement piece, right? We must do more about that, right? So we've invested significantly when it comes to engagement. We've created a whole chief engagement office to do just that. Put 16, 17 FTEs really focused on engaging in very classic ways, whether it's phone calls, showing up to the VFW, the American Legions, also very innovative ways, right? But working in partnerships with the VA and with the nonprofit community as well, and the cities and towns and our veteran service officers. To me, that's been a key and really a focus of our agenda here. It's engagement, 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 and that's what we preach across the entire agency, no matter what we do. And it's not just an engagement internally within our office, it's externally as well in state government, right? Because we have a variety of programs, just like any state does, whether it's transitional benefits for socioeconomically challenged families, whether it's the Department of Children and Families, whether it's Medicaid, you name it, that are interfacing with veterans day in, day out, who might not be connected to the system. So how do we, in government, operating from our space, in the veteran space, coordinating our efforts across state government to find those veterans and engage with them in a very real way? And that's what we're committed to doing. And as someone who tries to channel his community organizer background and former role in elected office, it's really a very personal touch. If I could door knock on everybody's door and say, hello, my name is John, we're to help you serve you, I would do it. Obviously, I can't do that. So how can we recreate that virtually, on the road, town halls? I mean, one of the first things I did as secretary is I visited every county within 90 days. To reset those relationships with communities, to say, listen, we're here, we're present, and we want to engage with you. We're investing in resources across the state. Now, Massachusetts has oftentimes a reputation where folks who live outside Boston feel like all the services and resources are within Boston, right? And so we wanted to make sure that that wasn't the case. So how does the secretary and his team get out of Boston, right? Partly, and I know Coleman feels the same way. That was the idea of the SAFE program. Get out of Boston, get out of the offices, go to the veteran, be as externally focused as you possibly can be, customer service oriented, and that's what we're preaching here, right? So we've decided to focus resources, staff in other parts of the state, and I think the dividends are showing. People are engaged, people feel like they're a part of the solution here, and they want to be a part of the movement that we're creating here in Massachusetts.
That's really important, Mr. Secretary, and I think it brings up when we talk about other parts of the state or the Commonwealth. One population that is significantly isolated from a lot of these is our rural veterans. And whereas California obviously being much bigger, you have probably a bigger space of rural veterans for you to outreach to. But it shouldn't be lost on people that despite the size of Massachusetts, once you get past the middle of the state into the western part of the state, it is very rural and very isolating, and people don't always have access to internet. People don't always have access readily to VA services in their area. Could you maybe Secretary Santiago, then I'll go to you, Secretary San. Can you talk a little bit about how you're trying to reach that population and get them engaged?
So outside of the engagement office, right? And I'm telling you, we're talking about engagement where I can tell you since October 11th of 2023, we've answered 3,355 phone calls and answered 95% of them with an answer referral, right? So, and I get a spreadsheet every week about what we're doing because I really mean it, and that we have to really engage these folks, speak with them, and learn from them, right? Investing in these resources on other parts of the state, but I think capitalizing and leveraging on the ground resources. In Massachusetts, we're unique in that every city or town of over 12,000 people, I believe, is statutorily required to have a veteran service officer, right? So we have over 200 across the Commonwealth of Massachusetts. Now, what this person does is that they're a municipal hire, they work for a city or town, and they're the veteran person there, right? Supposed to connect them to state benefits, federal benefits. Now, they don't work for me, they work at the city and town, and oftentimes they are one or two people in their offices. Sometimes bigger cities have more folks, but making sure that they are connected to us in a very real way, not just like, listen, they're the folks in Boston. We'll let them know if they need a state benefit here and there, but how do we support them? How do we encourage their efforts? How do we provide them resources? You know, we just came out with a grant for a couple $1 million to do just that. And how do we improve their training, right? And how do we make them feel part of the team here? Again, they don't work for me, right? But the more that I empower the frontline service provider, as I like to say, and again, they're everywhere. There's 200 plus statutorily required if you're a city or town of 12,000 people, the more that we're getting buy-in from the local community and from the veterans there, right? Who can't make the trip to Boston for a variety of reasons, right? And particularly in the western part of the state where there are VSOs, these municipal hires that are covering large areas, right? How do we partner with them and share the load of doing the outreach, but how do we do it in coordination with one another? I think that is a unique part of the Massachusetts experience, and that's one that we need to leverage and build on.
Yeah, absolutely. Secretary Sin, do you have any thoughts on this?
Oh, absolutely. But first, Secretary Santiago, I just think it's really exciting to hear what you're doing. I really commend you for getting out and visiting, you know, every part of your state that you can. And I think that's really sometimes the key is just letting people know you're there. It means so much, I see, to our veterans when we can get out and connect with them directly, answer their questions, listen to them. And I am amazed always at how sometimes it really just takes a phone call or two to be able to connect somebody that quickly with a benefit that they either didn't realize they had or they just for some reason could not access. Definitely rural California makes up a good part of our state. And while the bulk of our veteran population resides in the kind of more populous cities and kind of hubs of our state, it's certainly not lost on us that per capita, more veterans live in rural areas because for whatever reason, that tends to be a place where they want to be. So of course, our challenge is balancing that consistent, and I like the word engagement better than outreach here too, engagement with veterans to make sure that they know where their resources are. So a couple things we leverage here in the state would be, first, we have a program called our Local Interagency Network Coordinators at CalVet. And these are 7 individuals who are embedded in different communities, kind of regions of the state. Early on, we divided our state up into 7 regions. And they're really the boots on the ground that go out and connect with our county veteran service officers. We have 56 county veteran service offices for the 58 counties in California. And those offices often can comprise anywhere from 2 to many, many more people, depending on the size of the county. And their whole mission is to work with veterans directly at the county level to connect them, especially with benefits like disability compensation, aid and attendance, pension. But they do a lot of things to get veterans connected with their benefits. So our links are responsible for really developing relationships with those folks, relationships with our community-based systems of care, whether that's nonprofit organizations, universities, VA outreach workers, et cetera, so that in each of our communities, anytime we get a phone call from a veteran, anytime a veteran calls our office, it's really a link who's picking up the phone and directing them to those services or connecting them directly. In fact, I regularly get emails and phone calls from my colleagues across the nation, other secretaries who say, hey, we've got a veteran that is not getting connected for some reason, or it's a friend of a friend or a relative of a friend. Can you help out? And immediately our links just pick up the phone and connect with that person. And I've seen this happen in real time, especially over the last few months. And it's really remarkable, the kind of relationships that we've built across the nation and then here in California. So with rural veterans, that presents very unique challenges because, of course, these are folks who, just like Secretary Santiago said, may not have reliable access to internet. They may be in pretty far-flung rural areas where it's hard to travel. We know that even VA care may be difficult for them to get. So our partnerships with our community-based providers are really critical. Our partnerships with our county veteran service officers, whom we also fund a portion of their activities in order for them to go out and do some of this kind of far-flung work. Those are really critical. And our county veteran service officers this last year, we supply about $11 million a year to them in subvention funding. It equates to about a quarter of their funding in their offices. They were able to submit 300,000 claims on behalf of veterans across the state, and that was about $550 million this last year. That came down to one-time awards and ongoing awards for veterans in California. And that's the highest volume of claims and dollar amounts we've ever done. But often that comprises our rural areas as well. And so those county offices were really critical to us during the pandemic because they quickly shifted to remote work. They were taking telework appointments for veterans. They were, and any veterans they could connect with via reliable internet, they did. And they kept those offices open. And where they couldn't continue to be open because they had to work from home and didn't have that reliable infrastructure, it was our LINK program and our engagement and outreach workers through the CalTAP program that really stepped in and started answering those phone calls from veterans directly. So I think a lot of the rural engagement and outreach that's needed comes down to us working with our partners on the ground in those areas. And that also includes populations such as veterans on tribal land that are sometimes harder for us to reach. So oftentimes we try to go to where they are. We work with those county offices again, or with our minority and underrepresented veterans unit to really engage in the way that our veterans in tribal areas and just Native American veterans want to be engaged with. We actually, I'm excited to say we just got a grant actually from the VA to study suicide among tribal veterans as well. So we'll be kind of rolling something out here soon and a bigger announcement about that as well. But that really means we've got to look at what resources we need to direct into those rural areas and leverage things like financial grants from the VA when they come about. And back to Secretary Santiago's point, also work with across state government with all of the other resources that we have to bear that are not necessarily veteran specific, but really impactful to Californians. And so I sit on a number of advisory boards and committees with my colleagues across state government, including Interagency Council on Homelessness and the Jobs First Council. And the intention of all of that is for us to work better together so that we can meet the needs of more Californians, especially those in harder to reach areas.
Wow. Yeah, it really sounds like for both of you that you've taken sort of a not a one size fits all approach, and also that that in order to do this, particularly at the state level, there has to be some sort of a force multiplier amongst other agencies and services to be able to do wraparound. I know we have some questions here from the audience, and I want to get to those. Basically, and this was actually good because this question actually was going to be something I asked if I had time. Harvard recently did a study that shows that some research that shows that post 9/11 veterans are getting what's commonly referred to as bad paper more often, right? So bad paper would be a discharge characterization, which is less than honorable or under honorable conditions. And we know many of those from the past came from the LGBTQ plus community for the don't ask, don't tell policy being enacted. But we also know today that we see a lot of veterans with great time in service in terms of their accomplishments and how they were able to succeed while they were deployed, but have struggles and challenges when they come home, whether it be with substance abuse or other issues, which then affect their military service, which then sort of gives them an other than honorable or a less than honorable discharge. Secretary Santiago, let me go to you. What are the states doing to support veterans like that?
Yeah, I think this is really a cutting edge issue. I think there was a report, I think it was Brand, I think that came out with I was not knowledgeable to the extent that, I mean, I was under the impression that 99% of people get an honorable discharge, and that wasn't the case at all. I mean, these are complicated cases, right? And these are the people that need the most help often, right? You know, maybe they were enlisted, maybe not enough years, but they need the most help, right? And so we should be doing our best efforts to make sure that they get the care and services, benefits that they deserve as well. And here in Massachusetts, you know, we have to, first of all, let me credit the VA for really moving forward in a more inclusive approach to this, right? That leadership from the Biden administration, Secretary McDonough, to do just that. And so what could we do at the state level to match that, if not push that a bit further here? So one of the things that we did here in Massachusetts is that we passed the HERO Act. It's the most comprehensive piece of veterans legislation passed in Massachusetts history. And a big part of that was looking at this definition of a veteran here. Prior to the HERO Act, we had very strict standards for this. You had to have an honorable discharge for so-and-so, such and such benefits, right? And we said, let's be a little bit more inclusive when it comes to that. So for state benefits that my office provides, you no longer need that high bar of honorable discharge, right? And so that is one thing we're looking forward to seeing the course of the next year, how many more people will be eligible for important benefits that we offer, whether it's our Chapter 115 program, which is effectively the safety net benefit program for veterans, which has been around since the Civil War, actually. But you couldn't get access to it if you were, you know, a less than honorable veteran. More so than that, we've actually gone above and beyond that. Thanks to the leadership of Governor Haley, we've put forward what's called the Veterans Equality Review Board. Effectively, that's a review board that says, listen, if you've had a less than honorable discharge because of don't ask, don't tell, and you feel like your benefits at the state level were denied to you, let us know, talk to us, explain the situation, send the paperwork, and we have a verb commission, effectively, of 5 people that will look at that, and we will be able to really grant you your state benefits that you were denied because of this unjust policy. And not only did we see some folks getting back to us, contacting us, letting us know about it, but we decided to expand that, right? Because if folks were discriminated because of their sexual orientation, as you said, Coleman, when they come back from deployment or what have you, they might be experiencing a whole host of issues. So if there's a class that you belong to, whether it's race, mental health situation, or what have you, feel you've been discriminated against, if you're a protected class, the verb has been expanded in the HERO Act to include those protected classes as well. So that was just instituted a couple of months ago with the signing of the HERO Act. So our hope is to get the word out, let veterans know that you feel if you've been discriminated against, without having to go through the upgrade and discharge paperwork that can take a while at the federal level, at the state level at least, we want to let you know that we hear you, we see you, we want to work with you to get you the benefits that you were denied, particularly because you were wrong for a certain circumstance that may not be your fault.
Oh, excellent. I do want to give Secretary Sin a little an opportunity to weigh in a little bit on that. But I'm going to put you guys a little bit on the hot seat now, not too much, but a little bit, and ask. You work, and I know this for a fact because you work with VA, you work with Congress, but you see the decision implications of those decisions and those systems at the very local level. So for both of you, and Secretary Sin, please feel free to weigh in on the last question as well too. But I am curious, if you could convince Congress or VA to change just one federal policy, what would that be?
I have to start with that one.
Yeah.
Well, gosh, it's hard to say there's one policy that needs to change, but if anything, it is, definitely along the lines of access to quality care, access to benefits, in any way that we can make that easier for veterans in recognition of their service, we have to do it. So going back to the first question and the issue of bad paper veterans, this is nothing new. This has been around for decades and decades and decades. But I think it actually warrants attention now or gets the attention that it has for so long absolutely needed because of a variety of factors. For one, I think to the VA's credit, they seem to be more proactive about their understanding of what access to benefits should really mean. And I think that is a mindset change among the VA leadership right now. I think the Biden administration and previously the Obama administration had a lot to do with that. But prior to that, when VA had to make changes, it was because they were forced to, usually through litigation. And that goes back to toxic exposures, that goes back to uranium depletion, Gulf War illness, that goes back to a variety of ways that VA would consistently over the years kind of limit what veterans had access to based on what their character of discharge was or their character of service. And so now you have a VA that is much more understanding of what reality really is, which is that the military doesn't always treat its service members well by any means. And when people leave the military service for an other than honorable discharge or break in service early, it is usually derived from and can be derived from a variety of factors that happened to that person while in the military, whether that was trauma, military sexual trauma, trauma related to identifying as LGBTQ, retaliation for their sexual orientation, their gender identity, retaliation for reporting an assault, harassment, discrimination of some kind. This is nothing new to the military, unfortunately. But we are in a place now where, in recognition of that, we have opportunities because the VA has built systems for discharge upgrades, or the military has built systems for discharge upgrades, and obviously that is pursued through the legal process. Or the VA now grants a status where benefits can be reinstated through character of discharge changes because the discharge upgrade takes so long. We can now kind of tackle this issue and start identifying more and more veterans who really have been left out of benefits. So I really commend what you guys are doing in Massachusetts. I think that's huge. In California, it started with changes years ago in our military and veterans code and how we really looked at and perceived that definition of veterans. We made it clear after, I would say a lot of this is over the former leadership of the leadership of my former boss, Dr. Vito Bassiani, who is LGBT, so he, being the first openly gay secretary of the California Department of Veterans Affairs and one of the few openly gay secretaries in the governor's cabinet, really kind of led this charge for us to change how our definition of veteran may impact people inadvertently. And that meant that we would allow spouses, regardless of gender and sexual orientation, into our state veterans homes, for example. We also looked at changing our military and veterans code to make more inclusive language. When we talked about the original language was a widow, a veteran and their widow, for example, we made concerted efforts to change that. So even though processes have to be in place to actually open up benefits to veterans that have not received those benefits for some reason, we also have to look at our mindset change and language and how that is really important. And the way that we start with kind of recognizing that we need to be more inclusive is sometimes very simple. It all comes down to the language we use and how we talk to people and how we listen to what their needs really are. I think that has started in California a number of years ago and was kind of the first steps that we took to really looking at how we can open up this kind of world of benefits that veterans had not had access to. So with that, we've also worked closely with our partners at different nonprofits and, different schools like Berkeley and now hopefully Stanford and University of San Diego to support those legal clinics where they are actually, students are pursuing discharge upgrades on behalf of veterans. And I think that's really impacted people's lives in immeasurable ways. So I hope we continue to see that here in California. A law was recently passed in California that does establish a program for us at the department to pursue discharge upgrades for veterans. It is unfortunately not funded right now. So we're hoping that we will see changes to that in the future so that we can make this a permanent part of our programming as well. But right now, there's a lot of good work happening, at the university level among law schools in California, and that's exciting. And then, of course, VA has just announced they'll be publishing some stuff in the Federal Register for comment that will be more grant opportunities for state entities and others to be able to get grant funded to do this work. And so we hope to be a part of that as well.
That sounds amazing, both of you, and I really I lament that we've kind of exhausted our time here because and I don't mean to show my policy nerd flag too high, but I could have this conversation for about 4 or 5 hours and never get bored with it. But I do want to get back to Dan. I do want to say this has been a very powerful conversation. I think some really great ideas, and it's amazing as well as heartwarming to know that that the people filling these roles at our state level are smart, dedicated, and really forward-thinking individuals like yourselves who do believe in an inclusive and broad approach to all of our veteran services. So, and we've heard so much. So thank you so much for that. Again, would love to continue this conversation. Nudge, nudge, wink, wink, Dan Nagin, if there's ever additional opportunities. But with that, I'm going to pass it back to Professor Nagin, and I do want to thank both of you for your time, as well as thank all of our audience members for their interest in tuning in. So, Professor Nagin.
Thank you so much to our distinguished guests, Secretary Sin and Secretary Santiago. Very inspiring words, and your dedication to the veterans communities in your state and across the nation. Know that you have our utmost respect and gratitude for your work. And to our moderator, the distinguished Vice Chair of the DAV Board of Directors, Coleman, thank you so much for leading such an interesting and compelling conversation. I do want to close by saying that one of the purposes of the DAV Distinguished Speaker Series is to move from discussion also into action. And I think that both of our secretaries here have described action steps that are being taken at the local level and innovations that are being taken. And I think there are lots of opportunities for others to contribute to this work, whether they're in other states or in California or Massachusetts, to partner with their state agencies, to partner with their local VSOs. We will post the video of this conversation on the Harvard Law School YouTube page. We will also make sure that word has gotten out about the important conversation that you've had here. And so I want to bring this to a close by thanking you again, and also thanking our audience for caring about this topic. And as I said, we will all try our best to carry the torch forward. And thank you for providing such an inspiring message today. Hope everyone has a good afternoon or morning.